Hey guys, Tony Maritato here, licensed physical therapist, and in today's video I want to answer a post that came in through the Total Knee Replacement Support Group for Kind People. That is a closed Facebook group. I'll put a link to that group down in the description. It's totally free. It's a great community. So the post says, went to my 6-week follow-up today. Although it went like I expected, it didn't go how I wanted it to. Range of motion is good. 115 degrees of flexion, 0 degrees of extension. That is amazing for 6 weeks. Good stability. The x-ray looks, quote, perfect, of course. And she says that because physicians always will say that the x-rays look perfect even when there's other problems. So she goes on to say, sorry, my dog's barking. You guys remember Tucker. I tried to tell him about the constant pain and popping every time I take a step, like my kneecap is hanging up on something, sending a shooting pain through my bones. I was told he didn't want to hear anything about the pain for another 6 weeks and, quote, "You don't want to have another surgery, do you?" end quote. He totally dismissed the fact that I can't walk more than 30 steps without being in extreme pain from constant catching on something. She's talking about the kneecap catching. I know it's a long journey, but I was hoping he would at least try to find something to figure out what was causing it. Just feeling a little defeated. So guys, I hear that story a lot. I hear it across different patients, across different conditions related to a total knee replacement. And you're right, you're 1000% right. Like, the responsibility of the surgeon, the physical therapist, anyone on your recovery team is to listen to your story, to try to interpret what it is that you're experiencing, and then to dig deep into figuring out what we think is going on. So is this something that's going on with the patella, the kneecap itself? Is this something that's going on with the surrounding structures? What could be causing this sensation of catching? Now, this particular individual who posted this mentioned in another response that she had had another knee replacement. She understands the normal noise, the tapping sound, the clicking that happens. This is very different. And I agree. Typically, when somebody is experiencing a tapping or a clicking in the knee, pretty common, it's not associated with pain. When somebody is experiencing a catching and a painful kind of sensation when it either releases or a catching with buildup pressure that kind of clicks and the kneecap's moving, that's usually an alignment issue. Now, certainly there could be something going on with the surfaces that are coming into contact, but truthfully, my first thought, while your flexion extension is doing really well, I would love to see the alignment of the knee in this case. So I've got other videos on the channel where I talk about the Q angle. The Q angle is the angle from the hip to the knee to the foot. Some people will call it like a valgus angle, but it's basically like if you think of a person who has knock-kneed, the knees are in, the feet are out, the hips are out. That's a situation where that Q angle might be compromising or changing the way the patella is tracking vertically. And so you could be experiencing some issues with poor tracking of the patella. There are some ways that you can resolve this. Usually as a physical therapist, what I try to do is I look at the patient's movement patterns. I watch them walk a little bit. I look at the point in the knee flexion extension where she feels like the patella is catching. And I either try to rotate the hip, I try to turn the toe in, I try to do things that change the alignment, even if it's just temporarily. So if I have somebody who's walking comfortably and they experience this catching pain sensation, I might have them turn their foot in. I'm not going to teach them to walk like that, but if that resolves the issue, then we know that there might be something going on with the alignment. I might try to have them rotate their hip. I might have them take a wide step, a narrow step. There's lots of different things that we can do. And then if they're in the clinic with me, I would do some stability testing. I would look at measuring the Q angle. I would look at trying to determine if I thought there was an issue with the mechanics of the movement itself, there was an issue with the bony alignment. I would try to establish maybe some soft tissue work, would relieve some active muscle guarding that would allow the kneecap and the lower extremity to move more freely. There's a countless number of things that I could be doing in the clinic with the patient. Now, this is where I would say, obviously, the surgeon doesn't have the resource to be able to do that. They don't have the time. That's not kind of part of what they do. They're going to look at the x-ray. They're going to listen to your story. And if they don't really have a solution on hand, they're kind of out of options. But that's where your physical therapist comes into play. And that is where having the right physical therapist who has the time, has the resources, the interest, like we have to genuinely be curious to figure out what's going on. That is where a great physical therapist in your corner will really help you navigate this. You probably will be able to figure this out, and it'll probably get better with time. And when the surgeon says another 6 weeks, that's probably true. But to have to deal with the pain and the anxiety of not knowing what's going on between now and then, that's not something you should have to suffer through. So my recommendation is find a physical therapist if you don't have one already that will take the time to look at how you're moving, to adequately assess what's going on, to dig deeper, to do the investigation so that you and the therapist together will figure out a resolution to this problem. Guys, as always, thank you so much. Subscribe to the channel if you haven't, and I'll catch you on the next video.